Good morning, my name is Jonathan Surrey. I am a student at University of Phoenix. This assignment is for my class Nursing 486, and today we will be discussing accreditation and accrediting bodies, specifically the Joint Commission on Hospital Accreditation. In layman's term, accreditation is a form of approval, a seal of approval that is offered to hospitals and institutions that reinforce better quality care and safe quality care. The Joint Commission is an accrediting body that offers accreditations to hospitals and was established in 1951. It is a non-profit organization as well. I'm going to read you their mission statement just to get a feel of what they stand for. And it says here, the mission of the Joint Commission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Its vision is that all people always experience the safest, highest quality, best value healthcare across all settings, and that is straight from their website. So as stated before, they were established in 1951, and by the end of the 1960s, they were able to write standards for healthcare for hospitals and approved those accreditations. In the 1970s, they became established within psychiatric institutions that dealt with abuse, substance abuse, as well as psychiatric health issues. And in the beginning of the 1970s, they were able to be accrediting bodies for psychiatric programs, specifically institutions that dealt with psychiatric patients as well as substance abuse patients. In the beginning of the 1980s, they became established within hospice care settings and was able to accredit those hospitals and institutions that participate in hospice care. And at the end of the 1980s, they changed their title from the Joint Commission on Accrediting Hospitals to the Joint Commission on Accrediting Healthcare Organizations. So as you can see here, they are expanding widely from just hospitals to healthcare organizations. In the 1990s, Quality Healthcare Resource Incorporation and the Joint Commission come together and they form the Joint Commission International. So now they're growing nationally. And at the beginning of the 2000s, the Joint Commission publishes the first comprehensive set of international qualities standards for hospitals. Then in the beginning of 2000s, they become accrediting bodies for specific things such as surgery practices, as well as critical access for hospitals and disease-specific care programs. And then in the 2010s, they become more accredited in specific things as well as imaging, so diagnostic imaging centers. And then in 2012, they become accrediting bodies for the American Heart Association and American Heart Stroke Association for comprehensive stroke programs. In 2016, they become certified for hip and knee, total hip and knee replacement and critical access hospitals and ambulatory surgery settings, as well as comprehensive cardiac programs as well. And then in 2020s, considering the COVID pandemic that just happened, it says here on their timeline that the Joint Commission issued a statement supporting the use of standard face masks and or respirators provided from home when healthcare organizations cannot provide access to protective equipment that is commensurate with risk healthcare workers are exposed to amid the COVID-19 pandemic. So in this timeline, we have seen a progression of not only safety but quality care that is offered for patients. I think one of the most fascinating things about this accrediting body is that they progress in not only what is offered at the time, but in ways that also can help patients in not just one care setting, but in multiple care settings. Some accrediting bodies only focus on institutions or hospitals, but here with JCO, we've established that they've talked about orthopedics, knee replacements, even pathology, all the way down to now, which is with the COVID pandemic. So that shows that there is a progressive, continuous treatment for quality and safety that is offered for institutions. The reason for existence of the Joint Commission is to ensure that institutions that are participating or that are associated with the Joint Commission are following standards of care and practice that is best used in the clinical setting. The Joint Commission ensures that nurses and staff workers are applying the standardized practice to their care, which in turn ensures that the patients of those institutions are receiving quality and safe care. In the article, Quality and Safety Through Compliance with the Joint Commission Requirements, written by Carolyn E. Rizin-Nowinski, she establishes that the Joint Commission offers their gold seal of approval, which is their accreditation, and that their process is offered through a survey at least every 3 years. So they come in every 3-year cycle. Because I have worked closely with the Joint Commission and have been part of their surveying process, I know how their surveying process works. And usually the surveyors, who is a professional in the field, comes in, and it's usually unannounced, and they will follow a nursing staff and follow you for a couple of minutes and just watch how you provide care for your patients. So from my experience, what they do is they also watch how you do your medication administration from start to finish, how you verify patients' identity using name, date of birth, their MRN number, their wristbands, and at the end, if all goes well, it is good for the hospital, and that means that you're providing the best practice and best care that you can. If not, the article that I mentioned previously states that these accrediting bodies exist so that they can also offer information and education on how to better provide care for your patients. So those are just some of the standards or what they look out for. Other things that they do look out for is like infection control, management, leadership skills, basically everything that you do as a nurse. One of the biggest things though that we have to always remember, and why this is important, is because the Joint Commission surveys institutions for the specific purpose of ensuring that quality and safe care is provided to these patients. So these standards, as they progress, as things change, they always want to see that there is a positive and healthy outcome for the patient. So with the Joint Commission, they drive the process of care, the delivery of care for patients in a sense of bettering the healthcare environment. So as I stated before, the frequency is every 3 years, so once every 36 months they come in to do their surveys, and their quality indicators are actually posted up on their website at the Joint Commission. They do have a tab where you can click on, and it will show you the measurements and the metrics and the reporting. Once you click on that, you can see what's going on with the institution. Why public reporting of these metrics is important? It is very important for public reporting because I think most importantly, hospitals and institutions will act accordingly when they know that there's grade or their metrics are posted to the public. This will ensure that hospitals are providing the proper care and the safe care for their patients when these metrics are out for the public to see. So for example, many patients have the right and have the ability to access all of this information on their computers or on their phones. And if they see that their quality and their metrics are not up to par for the patients, then the patients can choose any other hospital that they would like to go to. Another reason why public reporting is also important is because I feel that hospitals can compete with other hospitals in a safe way. So competition doesn't always have to be bad. In this sense, if a competing hospital or a neighboring hospital has better quality metrics, I guess the other hospital would have to try their best to up that hospital. So in a way, the competition for providing quality and safe care is, I guess, a good thing for hospitals, because that ensures that the patients are the number one priority. So for the current function of the Joint Commission, they operate under a board of commissioners. Some of these commissioners, or most of them, 21 of them actually, are they are voting members, and they are comprised of physicians, nurses, administrative people, and educators. They are represented by the American Hospital Association, American Medical Association, American College of Surgeons, and the list goes on. So as you can tell, that the Joint Commission is highly reputable. They are comprised of experts and professionals at what they do. They are also comprised of audit and firewall oversight, as executive, finance, governance, human resources, and executive compensation, and strategic planning. So all of these board members all come together to choose how the Joint Commission function. With these professionals overseeing the process of the Joint Commission, their surveying process is highly reputable. So when we are discussing about how the impact that Joint Commission has on each level of care, we have to consider that with healthcare organizations, usually hospitals and institutions, as I established before, they have been able to accredit specific areas in these healthcare organizations, like lab, diagnostic testing, pathology, and in specific like specialty care settings. So with the Joint Commission on board and their seal of approval and their accreditation, the impact that they have on these organizations show that they have to follow the standards of care and also offer the best and safe practices for their patients. And when it comes to nursing practice and patient care, the impact that the Joint Commission has is astounding. It's extreme because the Joint Commission, like I stated numerous times, their goal is to always push and drive for better patient care, quality patient care, and safer patient care. And so with nursing practice, the Joint Commission influences how we practice as well. Using the best standards and evidence-based practice, the Joint Commission ensures that we nurses are following those best practices. This in turn affects patient care because it ensures that the patients are receiving the best care that we can offer. In conclusion, the Joint Commission has established their credentials since the 1950s till now. Their organization is an organization that strives and pushes for quality care for their patients. Hospitals and institutions that participate or are accredited by the Joint Commission are set in place so that they can provide the best practices based on evidence-based practice and standards of care. This in turn affects how healthcare organizations run and how nursing practice runs, which in turn affects how we deliver care for our patients.